So that's the whole piece about integrating evidence into decision making while considering both the your expertise of your players, whether it's clinicians or administrators or whoever, depending on the decision you're making, or both, hopefully, and patient preferences and values. And patient preferences and values can be the community, individual patients, populations, etc. So that's step 4. Now we're moving on to, we've made a decision, we have decided to implement a practice change, and we've rolled out the new plan with great planning and piloting it and then rolling it out to the larger organization. And we want to evaluate, always want to evaluate whether or not the practice change was effective. So we always want to, as we go into any practice change, we want to include an evaluation plan for the outcomes before we even begin. So, outcomes and benchmarks, what they are and why they matter. So what are outcomes and what kinds of outcomes are there? So the IOM definition of quality is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So the IOM is really talking about outcomes, and that's the whole reason we exist in healthcare, is to drive great outcomes for patients in their clinical experience, right? So it's the right care for the right patient at the right time. The IOM has 6 aims for improvement, always with the patient in the middle, and I'm sure you've all seen these before. The 6 aims are safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. And so these are the things that we always want to have in mind as we're looking to improve outcomes. So quality of care can be classified into 3 aspects of caregiving. There's 3 different things that go on. There are structural things in the organization, and we're going to talk a little bit more about this. There's processes that we go through, and then there's the outcomes that result. So structures are static characteristics of the individuals who provide care and static characteristics about the setting where the care is delivered. Okay, so what kind of organization are we talking about? Is it a small community hospital? Is it a rural, remote access hospital? Is it a large academic medical center? What is the actual characteristic structure of the organization that you're in? These are important to understand when you're trying to understand how processes are going to work and how outcomes are going to be driven. Okay? When you're talking about the structure of the actual characteristics of individuals that work at an organization, these are the things like how many RNs have a bachelor's degree. We know from the literature that the more nurses with a BSN, the better patient outcomes are. So are you in a hospital that has a high percentage of RNs with a bachelor's degree or not? Those are some of those structural characteristics that are important to know and understand about the organization and know that their structure. Processes are what takes place during the delivery of care. So what actually did we do to drive the outcome, right? How many steps are in a particular process? This is where our lean folks and our QI folks really help us out with our processes to say, if we want to get from here to there, and we know what the best evidence is to drive this outcome, what's the process that we're going to put in place to integrate that evidence into our care processes to get us to the outcome? And how complicated are they? Or how simple are they? Or how many people are involved, right? And then there's the outcomes. And these are, did we get to the goal we wanted or not? Okay? So there's lots of different kinds of outcomes, right? There can be patient outcomes, there can be organizational outcomes, there can be lots of different types of categories of outcomes. But did we reach the goal we were shooting for? Okay? Structure, process, and outcomes are all related, but they are not linear. Like, just because you have a good structure and process does not always guarantee that you'll have a good outcome. Chances are you're more likely to, but it is not a 100% linear ratio relationship. So many things can influence the outcome. Some things we have no control over, like particular patient-related things, their genetics, their social situation. So there's always it's important to always recognize there are some things that we don't have a lot of control over. But the most important thing is that good structure and good process really do significantly increase the likelihood of good outcomes. So we should always be looking to try to think about having the right structural stuff in place, the best process in place, and then our chances of getting the outcome or the goal are much higher. So we talked a little bit about these. These are different kinds of outcomes. Patient outcomes, pretty clear, heart rate, blood pressure, pressure ulcers, having a healthy baby, knowledge of, something we've been teaching them, patient satisfaction, family satisfaction, provider outcomes, talked a little bit about that, employee satisfaction. There's a lot of work out there right now about employee engagement. So you may have lots of employees and they're satisfied with their pay and they're satisfied with their benefits, but they're not particularly engaged. And engagement is very, very important in terms of driving best outcomes. Retention rates, teamwork, patient safety, these are all provider-related outcomes. And then there's system outcomes, hospital outcomes, readmission rates. These bundled up hospital-wide rates that we report, patient safety related and readmissions, CAUTI rates, HAPU, all these hospital and system outcomes that you're all familiar with. So, how do we make sure we have outcomes related to the things that we're doing? So we're going to have an evidence-based practice change because what we're doing isn't best, so we're going to integrate a new way of doing things. We're going to create great structure and process to integrate the best evidence and roll out a new way of doing things. How will we know whether the new way worked or not? And we must think about this before we start so that we know, so that we measure something, so we measure it to see if we were effective. And if not, we can reassess. So outcomes have to be measurable. It has to be something you can say, we know what that looks like, okay? You also have to know, where am I going to get the data? Where is the data on this outcome? Do we already capture it? Is it in our electronic medical record? Is it in the lab database? Whatever. But you've got to really think about it and figure out, where does it exist? And can I access it? Or who owns it? And how will we be able to get at it? Is it easy to get at? Can we get at the specific information that we're interested in? The electronic medical record, we have tons of information in there. We are inputting data hours and hours and hours a day. So how do we go in and retrieve some of that information and make it useful? How much work will it take to get that data, right? Back in the day when we were doing, paper chart audits, we spent hours and hours gathering data. We shouldn't be doing that anymore because we have much more electronic information. How much money will it cost for us to collect this data? And how much money will it cost for us to do this project? So even if there is some cost to collecting the data, when we project what our savings will be, we need to be able to make that case. And is the project and the outcome important? I mentioned this earlier. This is that so what factor. Is it aligned with the strategic mission and programmatic initiatives of the organization? So we've got to make sure our project and our outcomes are important. Okay. So the outcomes of EBP they're conducted to examine changes in practice. EBP projects do generate outcomes, but they're outcomes that are specific to our internal project. EBP outcomes are not meant to be generalizable beyond what we did in our own place. That's why it's not like research, because the research is already done. We looked at the research. That was what our literature search was about. There's enough research out there that's done that gave us a compelling case to say the body of evidence says this is what we should do. Research is done. We're going to implement that evidence into practice. But we're not doing research. We're collecting outcomes on our EBP project. So we're not going to be able to generalize what we found in our place to the general public because we haven't put any of that research structure into place, but we don't need to because the research is already done. But we do want to say, did it work here? Did it help our patients? And then we do want to be able to tell other people, we did this same evidence-based project here at our hospital and it worked too. Doesn't mean it will work for you. But the more and more places that implement a particular way of doing things and then sharing that with other people through dissemination, the more likely, the larger the body of evidence becomes, and the more we know about how that process works in different places. So EBP project outcome data is about the evidence implemented in your facility and your practice only. And EBP project outcomes should be shared and disseminated. Because part of the problem is we have so many great EBP initiatives going on across the globe, and people are not sharing them. They're not even sharing them locally, let alone internationally, but we've really got to push this dissemination piece. So how can benchmarks help us? What is a benchmark? It's something that serves as a standard by which others can be measured. As applied in the business world, benchmarking is the identification of industry leaders so that their practices may be understood and emulated. So benchmarks are something that we strive for, something that independently represents the best. And so that's something that we want to measure ourselves against, right? There's lots of benchmarks out there that most hospitals and healthcare organizations are using to measure their own quality and progress against. So there's CMS, AHRQ. There's lots of patient satisfaction benchmarks and our DRG utilization benchmarks. So you know what these are, I'm sure, in your particular area of healthcare. There's lots of different benchmarks for all different kinds of healthcare industries. But these benchmarks can also often feel like they're put upon us. But in this case, it's a way to flip that thinking and say, how do we use benchmarks to our advantage to say, are we getting there through our EBP efforts? Okay? So you always want to dovetail your EBP projects with those important benchmarks which are put upon us, because we do have to be measured against benchmarks. So how are we aligning our EBP projects with the things that we're being measured on? So this is that so what piece. So what are the external mandates? You got to know what they are. What are the organizational priorities? What can we do in the project we're doing, or the problem we're trying to solve, that will have the biggest impact? So we want to look at these benchmark measures so we know where we're going, so we know where we want to end up, and we know how to incrementally measure ourselves. So benchmarks help us guide our EBP journey. QI and EBP really are and should be very, very aligned with one another. They shouldn't be independent of one another. Evidence-based practice projects should be measured through processes that quality folks have developed over the years that are, perfect for measuring the implementation of a change and measuring it over time and catching, when we start to fall off, and how do we, regroup, and how do we get efficient at what we're doing. And quality initiatives should be addressed through the EBP process. Like when we have a quality problem, we shouldn't be just trying things. We should be opening up the EBP playbook and saying, we have a quality problem, let's look at the literature and see what we should do to fix it. So they're very, very aligned. It's basically should be evidence-based quality improvement. That's really when the two pieces really align and speak to each other and help each other, and don't compete and don't misunderstand each other, because then both sides lose. So the last piece we're going to talk about is dissemination of the outcomes. So we've initiated this wonderful project, our evidence-based practice change. We had wonderful experience and we had great outcomes, and now not only do we want to share that internally and share the great news and recognize and appreciate all the people that have done such great work to get us there, but we want to also disseminate beyond our own walls. So dissemination allows others to understand the science and process behind the decision to implement a practice change, and it allows others to understand the results of the EBP project and the practice change to be made, and it allows an opportunity to recognize hard work. One of the key things in organizations that have converted their culture to be EBP friendly is the opportunity for recognition in EBP work. It's very, very important for this new way of doing things to be recognized and acknowledged, and for the people who are out, really getting this going, that are recognized and acknowledged in ways that are appropriate and a good fit. So recognition is very important. So getting the word out about what was the issue, how did we use the EBP process to address the way we approached the issue, what did we implement, how did that go, what did we find was working and not working, how did we realign it so that we had the most success, how did we integrate clinical expertise and patient preferences into the work that we did, and how did we measure our outcomes, and then what were these wonderful outcomes that we had. That's the kind of story you want to be telling about your EBP projects. So whether you tell them internally at your QI meetings or your director meetings or your administrative meetings or your board meetings, even better, once you've done that, then you want to get the word out. Okay, so maybe you have an opportunity to do a poster presentation at your organization. Maybe you have an opportunity to do a podium presentation at the board meeting and really share not only the great outcomes that you've had, but really celebrate some of the key people that were instrumental in really improving care for the patients in your organization or the staff. If you do a great recognition program or great recruitment program, and you have great outcomes relative to recruiting an incredible set of people, that's another thing you want to go tell people about. Another opportunity for dissemination would be presentations at your professional organization or organizations that support your project's focus, right? So you want to get out to those national conferences. If you had a project that was really, headed up by one of the clinical specialists on the unit, maybe on the oncology unit, then you want to encourage that team to go to the, Oncology Nurses Society and submit an abstract and go tell your story. Because what worked for you is very likely to be very interesting for a lot of other people in that specialty. So you really want to encourage people to get out there in lots of different ways to tell the story. Publication in professional journals is always a great idea. Some people are very intimidated by writing, by writing. And so how do we find the people who do like to write and who are good at it and partner them up with some of our folks that are really doing great EBP work and help these young writers to be able to feel comfortable getting into the publication arena. And the other thing is, tell the story any place, any time that anyone will listen. Tell your story and how evidence-based practice and the EBP process and evidence-based champions really, really are starting to influence your organization and decision-making and best practice. Make it your language. Make it the thing that you're talking about on a regular basis. Celebrate success. We talked about this a little bit. Even small projects that have impact. Even small projects that have small impact. I talked to people about don't try to boil the ocean to begin with. Do small projects where you get some small wins and people can really see in small incremental ways that are very meaningful how this process can really be effective. So small successes, small celebrations, large successes, large celebrations, all different, and mix it up. Don't do the same thing all the time. Recognize individuals who like individual recognition. Don't recognize individuals who hate being, like standing up in front of an audience. Be sensitive to what kind of recognition people are comfortable with, but always find a way to acknowledge this great work. So that's basically it. We've now got we've all walked through the EBP process from clinical inquiry, wondering, I wonder if this is the right way to do things, and how to formulate a PICO question, how to use the PICO question to search the literature, how to get into the literature and critically appraise it appropriately to find the body of evidence that speak to answering your question, then integrating that evidence with clinical expertise and patient preferences and values to implement a practice change, implementing a practice change, measuring the process and the outcomes, celebrating the success, and disseminating your work, and letting other people know about the great stuff you're doing. That's EBP, and that's what we hopefully have shared with you. Now, we're done with the steps of EBP. We have one more module left where we're going to be talking about making this a reality in your organization, sharing with you some strategies about barriers and some strategies to break through barriers, changing culture, and really, kind of day-to-day ways and strategies and some tools that we've developed that hopefully can really help you with getting EBP happening in your organization. So it's not just an idea, that we actually have lots of tools that can help you really make this happen. So that's what we're going to finish up with next time. But for now, we got through all the steps. So thank you very much, and we'll see you next time.